Good evening. Thank you all again for joining here with me this evening. I'm again tonight joined by Caleb Cage, the Nevada COVID-19 Response Director, to my right, and Ms. Julia Peak, also a Deputy Administrator in the Department of Health and Human Services. In this role, Ms. Peak is helping lead Nevada's statewide contact tracing efforts, and I am pleased to have them both here with me this evening. As I mentioned last week, we have learned a lot day by day about how best to analyze the data and tackle this disease. And in the last week, as I had mentioned, the Nevada Health Response Team finalized a long-term mitigation strategy for the state of Nevada to help us provide some predictability and stability moving forward. Today, I'm glad to have Caleb and Julia with me to help walk Nevadans through this plan. As I mentioned last week, tonight we are laying out a long-term strategy for mitigating the spread of COVID-19 in Nevada through a targeted approach, all centered back to our original goal of making our response state-managed and locally executed. As we all know, the state of Nevada and our nation are still in response mode to COVID-19 and will be for the foreseeable future. The virus is still infecting people and is likely to do so for the months ahead until a vaccine is developed. To be successful, we have developed a sustainable, targeted response model, one that will allow us to utilize all available state and county assets in this response and recovery effort, maximize consistency and accountability, and prioritize the communication of the state's most accurate data to the public and to decision makers. This is a natural evolution in the state's response, and one that recognizes a need for deliberate and predictable response for the protracted crisis of a global pandemic. At the beginning of this pandemic response, we took bold moves to flatten the curve by issuing broad-based stay-at-home orders and closures, and it worked. Because outside of a vaccine, we know that decreasing interactions and mobility is a successful measure to mitigate the spread. However, shutting down public and economic activity throughout the state is not sustainable in the long term. Hundreds of thousands of Nevadans lost their jobs. Businesses suffered, and our fragile economy took a massive hit, leading to negative impacts felt from the state's budget all the way down to household budgets throughout Nevada. But the good news is this: by switching to a strategic, targeted approach, we can protect the health and safety of Nevadans by mitigating the spread of the disease at the root of where it is occurring, all while keeping our economy open and avoiding hurting the businesses that are doing their part to help us. This new approach will ensure the state, in coordination with each county, can assess all the data and make timely decisions to address identified risk areas and take swift and appropriate action. In a moment, Caleb will walk through the details of this new strategy, the mitigation plan, but here's a quick summary every week. Using data, the state will update the 3 elevated disease transmission criteria for each county. The COVID-19 Response Task Force will then be able to review the criteria and see which counties are experiencing a decrease in risk or an increase, meaning a county met 2 or more of these criteria for 2 or more consecutive weeks. If a county is determined to have an increased risk based on the data, they will enter an assessment and review process with the state task force that could result in changing the county's mitigation effort. During the assessment, the task force and county will review all available data and statewide critical metrics to determine the root cause of the spread and ultimately come up with an action plan to address it, which could lead to targeted measures such as increased enforcement, decrease in gathering sizes, decrease in fire code capacity for certain businesses, and more. As I mentioned, the task force will not only be looking at the data, but also other critical areas that will help determine why a county might be experiencing an increase in risk level. They will include the following: hospital capacity, access to personal protective equipment, or PPE, testing capacity, case investigation and contact tracing, protection of vulnerable populations, and enforcement actions. It's through this review process that the county and state will be able to determine the most effective targeted approach to take to mitigate the spread in that area. For example, if the assessment determines that an increase in positives in the county are all stemming from a skilled nursing facility, then it wouldn't make sense to close down indoor dining. The plan should be focused on stopping the spread at those nursing facilities where it is occurring. In the case that there is not enough data or information needed to make a targeted approach for the county, or if a county is not collaborating with the state in a productive manner, the state will not hesitate to implement mitigation measures in accepted high-risk settings, but I remain hopeful for broad collaboration with this new approach. At this time, I'd like to turn it over to Caleb to walk you through the process in more depth. Caleb.
Thank you, Governor. I'd like to reiterate what you and others have said a number of times in recent weeks regarding the nature of our response to date. We're several months into this pandemic now, and we can be proud of the work that we have done. However, this virus is no less dangerous and present in our communities today than it was in March. Because it is so serious, and because we have learned many important lessons and built important capacities, it's time for our response to change. To be clear, we're still responding to this emergency, and our response needs to be sustainable for the long term. As the Governor mentioned last week, this new approach will have updated criteria for state and county partners to be assessed by, mitigation levels that will allow for more predictability, increased enforcement to improve compliance, and targeted approaches in partnership with our county partners. This new approach emphasizes communication, coordination, and collaboration. Overall, what Nevadans need to know is this: the criteria determines the county's risk level, and the risk level determines the mitigation level. We will be using the same criteria previously announced, which include looking at testing, case rates, and positivity rates, but we will be looking at a slightly longer time frame for each of those criteria. To get a better idea of the spread of COVID in our communities and to help normalize and stabilize the data. With time frame adjustments, the criteria now include the average numbers of tests per day per 100,000, less than 150. This is reported over a 14-day period with a 7-day lag. The case rate per 100,000 is greater than 200. This is now completed by taking the number of cases diagnosed and reported over a 30-day period and divided by the number of people living in a county. And case rate per 100,000 greater than 50, and testing positivity greater than 7.0. This is reported over a 14-day period with a 7-day lag. Every Thursday, the Department the Department of Health and Human Services will run a report of the criteria to determine how Nevada's 17 counties are faring. Then the task force, formed by Governor Sisolak, will reach out to county leaders to inform them of their status. Counties that do not meet 2 or more of the criteria will remain in baseline status, maintaining compliance with all of the statewide directives. Counties experiencing elevated risk will enter into an assessment process with the COVID-19 Response Task Force. And we will look at previous weeks of data, contact tracing results, and other critical areas the Governor mentioned earlier, such as hospitalization, community spread, and enforcement. Counties will be asked to create an action plan, which may include implementing certain mitigation levels beyond the statewide baseline, including potentially moving to 25% of capacity in high-risk settings or reducing public gatherings to slow the spread. The county's plan should be data-driven and should outline their efforts to target the sources of infection and community spread. Once the plan is approved by the task force, counties will be responsible for implementing the plan. Again, if there is not enough reliable data to take a targeted approach in a county, or if a county is not collaborating with the state in a productive manner, the task force and/or the governor will maintain the right to take action and implement across-the-board mitigation measures in certain high-risk settings. That may include in areas of increased spread, lowering capacity across the board in businesses, or potentially returning to phase 1 recommendations, which may include restricting high-risk businesses to curbside and delivery-only services or further reductions of public gatherings. The state will continue to provide support where necessary, and as the governor mentioned, the state will not hesitate to implement mitigation measures in high-risk settings, but I remain hopeful for broad collaboration with this new approach. The state will undertake a similar, thoughtful, and collaborative approach to ease up restrictions if county data show movement. We know that this is an important undertaking for Nevada. Our counties and communities are unique, and this approach helps provide targeted interventions to communities while recognizing that the virus is creating different risks in each of our counties. This partnership will help ensure the state and counties are communicating and collaborating in a coordinated effort to protect all Nevadans. Now I'd like to turn it back over to the governor for further remarks. Thank you, Governor.
Thank you, Caleb. I want to be clear. In no way are we relaxing our mitigation efforts. We're taking a more strategic, aggressive approach that will target this disease where it is spreading and take action necessary to stop it. And until the first assessment takes place and action plans are finalized between the counties and the task force, the current restrictions for bars, pubs, and taverns will remain in place for the 4 counties previously identified as meeting increased transmission risk criteria. Just as before, this plan or any other will not work if we do not have full participation from all Nevadans. Every county, municipality, business, employee, neighbor, and family. If Nevadans continue to wear their face coverings, as we're all mandated to do, along with practicing aggressive social distancing, this targeted approach should work. It will allow more sectors of our economy to remain open. If Nevadans begin to relax their efforts and take this less seriously, this target approach will not work and will lead our state backwards, which could ultimately lead once again to broad-based closures and limitations. I don't want that, and neither do you. We can both mitigate the spread and avoid harming businesses that are doing their part, but only if we all commit to doing what our part is. I implore you to remain as vigilant as ever. Make no mistake, Nevada, we're in a very precarious position. I promise you, I will give you all I have, my energy, resources, my focus, and my best efforts to continue to walk this tightrope between your personal help and your financial stability. But to get this done, I need you to give me all you have, too. Thank you, and I would now be happy to take some questions.
Reporters wouldn't mind you have a microphone set up so the folks on the live stream can hear the question at home. And if you could keep it to one question at a time so we can get through them all, that'd be great.
Hi, Governor. How are you?
Good.
There's a lot going on, and I want to get questions in about this subject, but I wanted to ask also, you signed AB 4 today, the elections bill, and I wanted to see if you had any more response to some of the criticisms that the president and the GOP are saying about that effort.
I did sign AB 4 earlier this afternoon. It is extremely important to me that our citizens do not have to decide between their health and their right to vote. Their ability to exercise their right to vote is extremely important to me. I think that this bill encompasses that, makes it easier for people to vote, and I'm proud of the bill that came over from the legislature, and we did sign it.
Thanks. We'll go to the next question, please.
About schools reopening. California has 100 new, or their protocol is 100 new cases per 100,000 people for every 2 weeks. And in Washoe County, it's currently 250. Do you think Washoe County is doing enough to prepare for the schools reopening?
The schools reopening is a very complex issue. We gave the authority to the local school jurisdictions. All 17 of them submitted plans to the Department of Education, and Superintendent Ebert went over those plans. I'm hopeful that they will be implemented, and my primary concern is to protect the safety of the students and the educators, at all levels educators, whether we're talking about bus drivers or teachers or cafeteria workers as it might be. Their protection of their safety is ultimately my #1 concern, but I ask the school districts to remain flexible and to monitor this very closely, and we'll get through it together.
Hi, Governor. The president specifically took aim at you over the weekend with some tweets. One of the things he mentioned, he said you were a clubhouse governor and accused you of doing things in the cover of night. What is your specific response to those criticisms?
Well, when I saw his tweet this morning, to be honest with you, I had to Google. I don't know what a clubhouse governor is. I still don't know what a clubhouse governor is because I couldn't find anything online to define it for me. I understand that there's an attempt to suppress voting. You know, it's my job to make sure that we give everybody that wants to vote the opportunity to do so and remain as flexible as possible. That's what AB 4 does. I'm confident it'll be well received. I was proud to sign it, and I'm proud of the work that the legislature did. And I have total confidence that the Secretary of State, working with the various registrars of voters across the state, are going to be able to implement and carry out this election come November.
Have you heard of any problems with the Postal Service being able to handle the volume of ballots that'll come in?
No, I think that that's a crazy claim, frankly. I mean, the Postal Service delivers a lot of mail. We're talking about a minimal amount of mail in the overall scheme of things that the Postal Service delivers. They deliver sample ballots. I'm sure they'll do a fine job delivering these ballots. Thank you.
Hi, Governor. Sorry, I'm taller than Michelle. So how do you ensure this targeted approach, business by business or county by county, doesn't confuse Nevadans either visiting businesses or counties or business owners?
Right. Caleb?
Thank you, Governor. Thank you for the question, Sam. Just to make sure I have it correctly, how do we make sure that this is clear enough for implementation and that it's easy on the user end, user-friendly for local businesses? This is actually, I think, a step in the direction of helping to do exactly that, to clarify. Our county partners are great partners. They're great advocates. They know the businesses in their communities. They know the business owners very often. And in our smaller communities or counties in particular, they're neighbors and their kids go to school together and all of those things. And so this approach allows us to work collaboratively with the counties to make sure that they are identifying what they see as the root cause of community spread or outbreaks within their communities and identifying ways to address those. And so many of the counties that would come to us with their plans and their self-assessments would be able to say, this is what we would recommend, and if it's approved and we would find ways of supporting it, they would have various mechanisms for putting that information out to the public like they would with anything else. And we would be happy to support them with the public information piece as well. But I think that the governor's intent here has been to make it predictable and to make it as steady as possible going forward. And I believe we achieve that with this strategy to a large degree.
Sorry if you said this, but did you say the date of when the first assessment you talked about was going to be?
So the plan revolves around Thursday morning meetings so that we can have Friday discussions, and the meeting will be meeting this week. We'll be meeting next week and until the end of the year. And for counties that are of elevated risk, we're already having conversations with them and their representatives to say, you know, this is something that may be coming, and you need to be prepared for developing a plan to mitigate the increase in community spread or outbreaks.
Thank you.
Governor, you mentioned with mail-in ballots that you are confident with the Postal Service. How can you tell voters and how can you reassure them that we're going to have fair and timely results?
Well, fair and timely results, I think that I have total confidence in our registrars. These things do take time. I will give you that. Part of the bill was to start being able to count the mail-in ballots earlier, which I think is going to be good. But the results are all verified. They're going to be accurate. And I think people can have total confidence in the fact that when they mail in a ballot, when they cast their vote, it will be counted in the next election, whichever method they use, whether it's in person or it's mailed in.
And you're secure and confident about the Postal Service?
100%.
Follow-up question to what he asked. Today, the Washoe Education Association filed a complaint with Nevada OSHA for unsafe work conditions at Washoe County School District. Do you have a response to that?
Well, I'm not familiar with the complaint that they filed with OSHA. I can tell you, again, I'm going to reiterate that protecting the health and safety of our students and our educators is a huge priority for me. As part of our CARES Act money, we've made PPE available to all the school districts coming back. There will be testing made available for all of the educators coming back. And like I say, we've left this up to the local school districts and elected school boards who are closest to these schools to come up with a plan that the parents and the faculty and the students all feel comfortable with.
Thank you.
Thank you.
Hi, can you be more specific about the new criteria that counties would need to meet? I know you have very specific numbers for how many tests, but like how much PPE? I guess I'm a little confused about the new criteria that counties will have to meet.
Thank you, Governor. So there are statewide metrics that refer to the PPE and vulnerable populations enforcement, and as well as contact tracing and testing. Those are metrics that, I'm sorry, and there's one more, hospitalization. Those are metrics that the governor and other people throughout the state who are responsible for this response watch very closely. There could be a situation where, and just a hypothetical situation where things are going great in terms of the three metrics that we're assessing, or sorry, the three criteria that we're assessing the county by, but we've got a critical need with hospitals at capacity or something like that. And so the metrics not only allow us to have statewide metrics on statewide assets or vulnerable populations or capabilities and capacities at the state level, but they also are the three or the six things that we'll be watching and asking the county governors or county governments rather to turn in their self-assessments and their plans addressing when they meet those three criteria. So the six metrics are really the items that we are watching on a day-to-day basis and have been watching since the beginning of the pandemic. The three criteria are what we are assessing the counties by on a weekly basis to determine whether or not there is an elevated risk level there.
Okay, so you're just determining by the three criteria, then when do the others come in?
So the six statewide metrics are metrics that we use at the state level to determine our ability to respond to the COVID-19 pandemic in the state of Nevada. So daily we are looking at hospitalization and how close we are to capacity in the hospitals. Daily we're looking at outbreaks in places like skilled nursing facilities and elsewhere so that we can determine where the problems are and what our challenges are. Daily we're looking at things like personal protective equipment for first responders, for instance, in local communities. Those are metrics that we observe on a daily basis in order to determine how our response is going and what our ongoing response is. Those are our metrics. The criteria are the county criteria that they are using, that we are using in order to assess their abilities at the local level in order to respond.
Okay, thank you.
Sure. The COVID-19 crisis has disproportionately affected the Black community, the Latinx community, and Native communities here in the state. So will the budget cuts approved during the last legislative session. Is your administration planning any specific interventions to help those communities with a recovery?
We're doing all that we can with our CARES Act money to funnel it into, where possible, to minority-owned businesses, to our minority communities. I think it demonstrates a bigger underlying problem that exists, in our state, in our country for that matter. The social inequity, the health care in the minority communities is nowhere near what it is in some of the other communities. The food security is nowhere near what it is in the minority communities, and the job opportunities are nowhere near. The education is nowhere near. I think it's pointed out some of the frailties and the faults in our system, and we're going to do everything we can to fix this, not just for the pandemic, but as we move forward and permanently. Thank you.
We'll take a couple more and then we'll wrap it up.
Is this new methodology being done in any other state? Where'd you come up with this plan?
Thank you, Terry, and thank you, Governor. So the methodology referring to the strategy, the long-term strategy that we have here. So we look at examples from states, whether they're regional, national. We look at information and data from all over the world, and as I've said before, we would be negligent if we weren't doing that. And so there are aspects of this plan that are certainly from different states in the region. I think you can look at the state of Colorado, Oregon, and other states in the Western Pact, as well as in the Western region, that are trying to find new ways of responding effectively. I'm very proud that this is that this plan is informed by best practices from around the country and around the world. But this is a very Nevada-specific plan. This is one that we've gotten input from our county and local partners on, and this is one that we've developed based on, again, those best practices that we have seen in actually dealing with the COVID-19 crisis and driving down the number of cases and making sure that we have the capacity to respond.
Thank you.
Governor, we're in the middle of the second special session. We've got a couple of major bills still outstanding. One is the unemployment bill, I'll call it, and the other we haven't seen yet, but we've seen drafts, the liability protections bill. Mm-hmm. Could you talk about those business liability protections, your position on that, and also give us a sense of what your attitude is about? Does the Dieter bill go far enough at this point? What else needs to be done there?
Okay, I'll start with the Dieter bill. The Dieter bill begins a process. You are going to see some more information coming out from our office later this week about some change in Dieter and some folks that we're bringing in to help us with this. And I'm excited about the opportunity. We've spent a lot of time dealing with this. It's extremely important to me that people who are entitled to the money get the money as quickly as possible. With that being said, you've seen some of the reports about the fraud that's going on. Today, someone was indicted for having, 21 IDs that they've used and unknown number of debit cards that were sent to them to use for this. So we're going to do everything we can, and this bill is going to give us more flexibility. It's also going to increase the length of time that people are eligible for benefits. As it relates to the business liability bill, this was a bill that a lot of effort went into. It's extremely important to me. We just got out of our first special session where we dealt with a $1.2 billion shortfall, which is massive. Our unemployment rate is at an all-time high. Our jobless rate is just something that's scary to me. I've got people that want to go back to work. We've got unemployment problems. We've got revenue problems, and I need to do everything I can as governor to protect the safety of the workers that are working in the hospitality industry in particular, that are helping us to lead this comeback, resurgence in our economy to get people coming back to Las Vegas. At the same time, I need to protect these jobs. I mean, these companies are operating on a very fragile situation right now. You've seen their earnings. I've talked to the executives and the company principals to deal with the situation. They're in a precarious financial situation. I need to do everything I can to make sure that those jobs are available for Nevadans as we work through this. And the other thing about this bill that's extremely important, I'm here, you've been here a dozen times and heard me asking businesses to please practice, make sure people are wearing masks, make sure you're doing the best in terms of disinfectant and hygiene and so forth. Make sure that there's social distancing in your establishment. Well, this liability waiver, this immunity only exists if the businesses are practicing the best methodology and they're following all the directives that we put forward. That's something that they're going to have to do. I mean, if they don't do that, they're opening themselves up to this liability. And trust me, there's going to be people there wanting to take advantage of it. Thank you.
Governor, you talked earlier about balancing the economics with the health issues. There are some people that say they don't think you would ever shut down the casinos again because of their importance to our economy. What do you say to those people?
I say to those people that I'm encouraging every business to do whatever they can to help us beat this pandemic. The gaming industry has been responsible, to most part, in dealing with that. This business liability protection is going to give them some security, knowing that they won't be subjected to frivolous lawsuits and to a plethora of lawsuits coming forward when they're doing the best that they possibly can. I will do whatever I can, whatever needs to be done to protect the health and safety of the citizens of the state of Nevada, the workers on the Strip in particular you're asking about, and protect those jobs. At the same time, I want to make sure that everybody does their part, and you can do that by practicing the guidelines we put forward, wearing a mask, social distancing, and avoiding large groups.
When you talked about mass shutdowns, are casinos still on the table going forward?
I think you've seen that, you know, and I'm not going to say a quote that's going to get taken out of context, not that you would do that, but all of our options remain open. If we identify that that is a major problem, that's where the infections are coming from, we would obviously have to take appropriate action. But what we do first is see, is it the casino or is it the pools at the casino? Is it the restaurants at the casinos? Is it the gaming tables at the casino? Is it the common areas at the casinos? We don't know. I mean, right now we're not having a major problem with any of those in particular. It's just an abundance of things. The biggest area that we've got issues with that are really hard to control, to be very candid with you, and I've been on numerous governors' calls, is family gatherings. I mean, when you get 8, 10, 12 people from a family together and somebody comes and is infected or brings it to their family members, it's just something that's devastating. An entire family is then affected as a result of that one individual. The other thing that happens, and I want to stress this emphatically, people that are going to work when they know that they're sick or that they know that they tested positive and they're infecting other people is shameful. It's selfish. It's something that has to stop. If you're sick, stay home. I mean, that's pretty common sense. I mean, but people aren't even doing that. We need to do much more to protect ourselves, but more so to protect everyone else, to protect your loved ones and make sure that we can beat this disease. And if you're not feeling well, stay home. And if you are feeling well and you go to work, please practice the social guidelines we put in place.
Thank you.
Thanks, Michelle.
Sorry, that's actually all we have time for. Sam, I'll circle back with you on your question. Thanks everyone for coming.
Okay. Thank you all.